So from your perspective as both a yoga guru and a medical professional, how can yoga be effectively integrated into medical health interventions in a tertiary care hospital setting such as ours?
Yeah, here it's sort of very interesting because Latha was talking about the primary and primordial prevention, which I think is the best place for yoga actually. So we have to
Yes, yes.
start at the young age introducing yoga as a holistic way of life, not just exercise, as a holistic way of life in tune with the value system of Bharatiya Sanskriti, Indian cultural ethos. But if we don't do that, we start to have all these manifestations that start to come: psychic manifestations, psychosomatic manifestations, somatic manifestations, and then finally in the tertiary care hospital, it is organic manifestations where the end stage of the medical condition comes to the tertiary care. It is not the person who has a mild headache who comes to tertiary care. It is not the person who is feeling off color today who comes to tertiary care. It is the person who has a serious mental illness. So in such a situation, you are doing a lot of patchwork most of the time, because we are trying to address the symptoms that are manifest, but we are often not given a chance to look at the cause. The Heya, Hetu, Hana, Upaya model of the Chaturvyuha is vital in all aspects of Yogachikitsa. So when we started our work in the medical institution at JIPMA and then now at Mahatma Gandhi Medical College and the Sri Balaji Vidyapith, I think one of the first attempts we made of integrating yoga in healthcare was in the psychiatry ward. Because the psychiatry department, and I hope nobody takes offense of what I say, but the psychiatry department in most hospitals is the trash bin for all the other departments. When they don't know what to do in surgery, when they don't know what to do in medicine, when they don't know what to do in cardiology with a patient, they cannot find anything wrong. They say it is in your head, go to psychiatry. So that is why I say it is the trash bin of all the departments. But I like to say at Sri Balaji Vidyapith, when psychiatry doesn't know what to do with them, they send them to their trash bin, which is yoga therapy and music therapy. Now, it is not an ideal situation that at the end of going every place you come to yoga and music. That is not the idea. As our dear Selvamurthy sir, our great inspirational mentor who enabled salutogenesis at SBV, he used to talk of medically unexplained symptoms. And he said 40% of the people coming to our hospital have symptoms which when you investigate, you cannot find a cause. So you go through all the scans, you go through all the assessment, and you cannot find anything. Now he said those are the people who right at the entry point should be sent to yoga therapy, music therapy first. If you cannot help them, then go to the other department. So we have the whole pyramid of healthcare is upside down. We have forgotten the importance of primary care. And this is why when we introduce yoga as a therapy, we are not only looking at the patients who come to the hospital, we are looking at our young students of our university. And I have been witness to so many students who come to us with all of these symptomologies, and if left, are going to end up committing suicide very soon. But when they come to us, the most important thing that they always tell us is, finally, there is a place I can be heard. The people who have a disharmony at the mental level of the Vijnanamaya Kosha and Manomaya Kosha level, they want to be heard. Nobody hears people. And because nobody is hearing in family, nobody is hearing in relatives, nobody is hearing in teachers, nobody is hearing in society, the young people start to go inward and inward and inward and start to go into this bottomless pit from which they don't know how to come out, and that drives them to these desperate situations where they take their own life. What is important is create a safe space. That is what we do. Be it a student, be it a family person, be it a patient of any disorder. Again, don't think that just because they have diabetes, they don't have depression. Don't think that just because he has a angina, he will not have anxiety. All of these things go together. When the body is not well, the mind is affected. When the mind is not well, the body is affected. Andam and Pindam are constantly connected. Psychosomatic, somatopsychic are constantly connected in every state of health and disease. What does yoga offer? It gives you a practical philosophy. It gives you a practical psychology. It gives you a practical spirituality, where we are not only talking of the concepts, we can also do something about it. When you feel restless, you can do some yoga practices. When you feel emotionally volatile, you can do some pranayama. When you feel anxiety and stressed, you can do some shavasana and yoga nidra. And this is why the first and foremost approach of Yogachikitsa is listen, let them feel they are being heard, let them feel they are respected as an individual, valued as a person and not a label of a disease. Why do people not seek help for mental health condition? They are worried of the stigma. Stigma is the biggest stumbling block in anybody seeking help for mental health. See, if you go and say, I have diabetes, you don't worry about the stigma. Even you are not worried of the stigma in so many medical, physical conditions because it is accepted. But if you say I'm depressed, if you say I'm over anxious, oh my God, kuch ho gaya unko, pagal ho gaya, paityan aitanga. What happens is immediately you are worried about what society will say, what your own family will say, what your colleagues will say, and so you hide it away until it becomes so big, you don't know what to do, and then you take desperate measures. So the first and foremost approach of Yogachikitsa that we approach is let the person be valued, let them be heard, give them a safe space where they can touch themselves in a positive way and be healed. Healing is more important than curing.
And can I add earn their trust also, sir?
Absolutely. The therapist has to earn the trust of the care seeker.
For the
Care seeker is seeking care. Never forget that. The care seeker is seeking care. The care provider should provide care. And if the provider doesn't provide care, the care seeker will never heal from any condition.
Thank you so much, sir, for that beautiful exposition of, you just put it in a nutshell what the problem is. The fragmentation brought together with yoga therapy, and thankfully, what was considered a trash bin, like you said, that was the miracle start for us. That gave the opening to establish in this modern medical setting that yoga as an adjunctive therapy could work very well along with whatever medications they are giving, along with all the analysis and scientific testing that they are doing. Adding yoga therapy is definitely going to heal the person better, right? So thank you so much, sir.